Hello everyone, my name is Justina Kopek and I am a healthcare technology consultant at MIPS Technology, and I also have Vaida Giacomavi-Chute with me, who is a healthcare technology engineer. Today we're going to be presenting on MACRA, the Medicare Access and CHIP Reauthorization Act of 2015. I'll go ahead and hand it over to Vaida. Thank you, Justina. Okay, so I'm sure by now everybody has at least heard the term MACRA. Very briefly, what MACRA is going to do, it is going to transition the practices to a value-based payment system. So for the rest of the presentation, we'll keep this value-based payment system in mind. Okay, so the very first thing we will discuss is the MACRA timeline. Many physicians don't actually realize how quickly MACRA will come into effect. Although the MIPS option does not begin until 2019, CMS typically employs a 2-year look-back period. So if you've participated in meaningful use or PQRS before, you will know that if you, for example, did not participate in 2014, you saw the penalties apply to you in 2016. So that is what we mean by a 2-year look-back period. If this 2-year look-back period applies, then what the physicians have in place as of January 1st, 2017 will affect their 2019 MIPS incentive. Achieving PCMH prior to 2017 provides eligibility for the advanced payment option and counts as credit for the MIPS. So if you're part of PCMH or an ACO in 2017, you could potentially get credit for MIPS participation. It takes about a year to enroll into these, so if that's something that you're entertaining, we would encourage you to get the information and start the enrollment process for PCMH ahead of time. Current incentive programs that promote value and quality in patient care, such as meaningful use, PQRS, value-based modifier, all of those you can see from the timeline will stop in 2018. The Medicare fee-for-service payments will continue with a 0.5% annual increase through 2019, and then the fee-for-service payments will not increase again until 2026. Going forward, what the physicians will need to do is one of the options under MACRA. They're either going to have to participate in MIPS or an APM in order to positively, or in order to continue having a positive cash flow. So the alternative to the MIPS is your APM advanced payment model, and that offers a temporary 5% annual lump sum payment that ends in 2024. So participation in patient-centered medical homes, PCMH, as I've discussed before, will qualify you for an APM. So what we'll discuss first is going to be the MIPS option. Under the MIPS incentive, which offers merit-based incentive payment systems, that's what MIPS stands for. You build on quality measures and concepts of incentives like PQRS, meaningful use, value-based modifier. MIPS adjustments will range from 4% in 2019 to as high as 9% in 2022. So these adjustments can be positive, they can be negative, or they can be neutral based on the national thresholds of other providers. There is a possibility of a 10% bonus for achieving the 25th percentile for the performance in your quality measures. Okay, so very briefly, the terminology that we will often encounter throughout the presentation is going to be MACRA. As Justina mentioned, this is the Medicare Access and CHIP Reauthorization Act of 2015. MIPS, which is your merit-based incentive payment system. QPP, which stands for Quality Payment Program. VBM is a value-based modifier, and APM is alternative payment model. Okay. What is MACRA? So I've mentioned in the timeline terms like MIPS and APMs. MACRA has two pathways. You could either participate in option 1, which is your merit-based incentive payment system. That's your MIPS. And that combines meaningful use, PQRS, and value-based modifier. We will review that shortly. Or you could go down the APM's path, and that stands for alternative payment model. And that incorporates things like your patient-centered medical home, accountable care organizations, APMs, and so forth. As mentioned in the timeline, depending on which of these you participate in, you will have either a positive, negative, or a neutral adjustment, the amount of which will depend on whether you're going with MIPS or APMs. For the first year, all of the providers must participate in MIPS. If you're already part of something like PCMH, you will receive credit for MIPS. Okay, so let's take a closer look at MIPS first. What MIPS is, as we mentioned before, is a combination. It pretty much takes and combines existing quality reporting systems like PQRS, value-based modifier, and meaningful use into one. So eligible providers are physicians, nurse practitioners, physician assistants, clinical nurse specialists, certified registered nurse anesthetics. If you fall into any of these, and of course, you know, there's more to it. You're more than welcome to read into it on the CMS website. If you qualify, you have to participate. Okay. Now, the way that MIPS is segregated, its eligible professionals will be measured on several different categories. Each of these categories has a composite score, and the quality measures that fall into these categories will be selected by CMS annually. So the categories for MIPS that we're breaking down into are the clinical practice improvement, quality, resource use, and meaningful use. Justina is going to elaborate a little bit more into those just slightly down the presentation. Okay. And very briefly, we've mentioned that eligible professionals, clinicians, nurse practitioners, PAs qualify. You are not eligible for MIPS if you are a first-year Medicare Plan B participant. So if you just got out of medical school and are just starting to practice for the first year, you're not eligible. Low patient volume practices are not eligible. So if you receive less, or if you bill less than $10,000 in Medicare billing charges and see less than 100 Medicare patients per year. The and here is important because it's not either one or the other. It has to be a combination of the two. If you are participating in an APM like PCMH or an ACO or a CPC Plus, you will be, you don't have to do MIPS. And then Medicaid participants don't have to do MIPS either. So this is a Medicare initiative at the moment, and if you are a Medicaid provider, you don't have to participate in MIPS. Okay, so I'm going to hand down the presentation to Justina, and she will go over the performance categories with you.
Thank you so much, Vida. So now we're going to take a deeper look into what exactly MIPS is. As Vida already previously mentioned, MIPS is going to combine the programs that you all are probably fairly familiar with at this point, which are meaningful use, PQRS, and value-based modifier, which is still relatively new, but we are going to be combining those three. So MIPS is going to now be split into 4 categories, which are quality, resource use, clinical practice improvement activities, and meaningful use of certified EHR technology, which is actually referred to as Advanced Care Information. And then each of these categories is going to have a total score that you can meet, and is going to have a certain percentage for which you're eventually going to get the total MIPS composite performance score, which is out of 100%. So the first category is quality, which was previously your PQRS. So quality is now going to be reduced from 9 measures to 6 measures, and there are no domain requirements. So in PQRS, you had to choose 9 clinical quality measures, and they did have to be split amongst 3 of 6 different domains. That is no longer going to be required for the quality performance category. You do have to have 1 cross-cutting measure. So an example of a cross-cutting measure is NQF 0419, which is documentation of current medications. And there is a list of other cross-cutting measures that qualify for this category. And then you do also have to have 1 outcome measure. So they are expanding the list of measures available to you. I don't have a total list of those measures just yet. In clinical and LIHTC MD, you can report on a total of 43, and eventually we are going to be adding more into the system. And then quality in the first year is going to be 50% of your total MIPS composite score. So it's very important for you to understand what the requirements are for this category and try to achieve as close to 50% as possible, since it's such a large portion of your MIPS composite score. The next category is resource use or cost. There's nothing really required from clinicians for this category. It's basically calculated from your Medicare claims, so as I mentioned, no additional reporting, and this is only 10% of your total score. Previously, this was your value-based modifier, so that may be why you're not very familiar with value-based modifier, but it did go into effect in the previous years, and it was combined with PQRS. The next category is clinical practice improvement activities. So this is something that's totally new. You may achieve up to a total of 60 points in this category, which equals 15% of your total MIPS composite score. There are about 90+ activities that you can choose from. You can find those activities on the CMS website, and medical homes do earn full credit in this category, so medical homes are a part of your advanced payment models. And then our last category is the advanced care information, which is previously known as meaningful use. This accounts for 25% of your total MIPS composite score. There is a mandatory requirement in this category, and one is obviously that you have to be on the most up-to-date certified EHR technology. And then the second is that you have to meet 100 points in one category alone, and that's the base category. So the base category has 6 parts to it, which are in the image at the bottom. A lot of those are relative to the objectives that were in the previous meaningful use program, so the terminology might be a little bit different, or the wording, but you can relate each of those images to a previous meaningful use objective. And then there is also a performance score to this. So you have your base score, you have your performance score, which equals 130 points, but you have to meet at least 100 points. And then you can also receive a bonus point for your public health registry. Public health registry, for those that are not very familiar with this, is either an immunization registry in your state, a syndromic surveillance registry in your state, or one of the registries that's related to your specialty. So an example for an ophthalmologist is the IRIS registry, or for a rheumatologist is the RISE registry. And then a little bit more on the scoring for the advanced care information. As I mentioned, you have your base score, then you have your performance score, your 1 bonus point, which equals your total composite score. Okay. And then we have our advanced APMs. So this is completely separate from MIPS. You have to choose either MIPS or the advanced APMs. Not everyone is going to be eligible for an advanced APM. The payments and the incentives are different for both as well. There is no composite score for this one. As long as you qualify for the advanced APM and you meet its requirements, you receive a 5% lump sum bonus from 2019 to 2024. If you are participating in the advanced APM, you do not have to participate to MIPS, in MIPS, and you're not subject to the payment adjustments that come along with MIPS. So as I mentioned, the requirements, you have to have sufficient payment and patient volume in order to qualify, and then qualifying advanced APMs are listed below. They include the comprehensive ESRD care model, the CPC Plus program, the Medicare Shared Savings Program, next generation ACO model, and oncology care model risk arrangement, which doesn't start until 2018. Future of MACRA. It is going to be a multi-payer initiative. So starting in 2019, you can participate in an advanced APM that was developed by non-Medicare payers and still receive credit for the incentives for the advanced APM. If you would like some more information on that, we posted a link to a guide that's created by CMS. Eventually, they are going to be updating the list of advanced APMs. So it will include your non-Medicare payers, and Medicare will also be adding more of their own. And then just to let you know that the quality payment program is going to align standards eventually as well, so that clinicians can move between MIPS and APMs if they choose to do so. So that's the end of our presentation. What we're going to do is host a separate session for questions and answers. So look forward to that. And then if you do have any questions and you would like to contact either myself or Vida separately, you can email us at justinak@microwise.com or vidaj@microwise.com. Thank you so much.